So welcome everyone. My name is Jennifer Guy and I'm a transplant hepatologist, and I am going to talk to you today about liver disease prevention and screening. And we've been doing this talk for some time now. This is our third year. And in the past, I haven't used slides, but this year I thought I would try something different where I would give a visual representation of some of the things we're talking about. And so if you're a visual learner like me, go ahead and look at the slides. And if not, please just go ahead and listen. And I'll cover a lot of what Dr. Tati just said and what some other speakers are going to be saying as well. But the overall goal for this symposium is to hear things in different ways on multiple occasions so that it starts to really sink in as you think about your liver and liver health. So thank you to the American Liver Foundation for organizing this seminar and for inviting me to be a participant. So the questions we'll cover today include: what causes liver disease? Do all liver diseases increase the risk of cancer? How do we screen for liver disease and liver cancer? And what do we do to prevent liver cancer and screen for liver cancer? So where is the liver and what does it do? So you can think of your liver as a triangle on the right side of your body. It's kind of tucked up right under the ribs. And when we think about the liver, we divide it into the left and right lobe because of anatomic considerations if we're thinking about surgeries and other procedures. You can see on this graphic, it's like a triangle and it has lots of neighbors. The gallbladder hangs off the liver, the pancreas is nearby, the intestines are running all through the abdomen and near the liver, the stomach is near the liver, and the spleen as well. So sometimes people will say, oh, I have pain in my liver. And we're really thinking as physicians and care providers, well, is it really the liver or could it be one of the other neighboring structures? I see that there may be a participant that raised a hand. Erica, let me know in the chat if you'd like me to respond. The liver disease is involved in many functions, involved in digestion, immune system, bleeding system, clearing of toxins, and processing of medications. And so I think of the liver as the quarterback of the body, and I often describe this to my patients, that the quarterback, the liver is involved in so many important plays that the body is making. And so it's really fundamental to how all the systems work together. So as Dr. Tati mentioned, there are many causes of liver disease in this country, but the most common ones are non-alcoholic fatty liver disease, which we're going to talk about in more detail, alcohol liver disease, hepatitis C virus and hepatitis B virus, and then also autoimmune liver diseases and genetic liver diseases. So there's an important spectrum of liver disease that was also mentioned. And, sometimes we use the word disease and people automatically get sort of worried that it's like worst case scenario, and that's not necessarily the case. And so I put liver condition here just to remind us that indeed there is a spectrum. And so if you have a liver disease condition, for example, those 5 causes I just listed, the question is it causing inflammation and irritation to the liver? And is that irritation going on to cause injury and scarring? And another word for scarring that you may have heard about is this word fibrosis. And there are different stages of fibrosis: early scarring, stage 1 fibrosis, and advanced scarring is stage 4 fibrosis or cirrhosis. So again, getting this sense that there is indeed a spectrum of liver disease. If patients have cirrhosis, then they're at risk for liver cancer. As mentioned, this is the traditional way we think about liver cancer, though there are some exceptions that we'll talk about, including hepatitis B, fatty liver disease, and we're going to go through this more. But overall, in people who have cirrhosis, the risk of liver cancer is about 3 to 7% per year. Another graphic and visualization to think about, and I tell my patients this, is that the normal liver is like a peach. It's soft and fleshy. And the cirrhotic liver is like a cauliflower or a broccoli. It's sort of hard and shrunken, lumpy, bumpy around the edges. And so when we get to the point of cirrhosis, you can imagine that if there is that much scarring, there's the potential in the future for abnormality or problems, including cancer. So not everyone with liver disease gets scarring, as also mentioned. And so this is where it's really important to, number one, say, hey, do I have liver disease or a liver condition? How does my doctor know? And your doctor can test for liver disease by checking for liver inflammation, These are tests like AST and ALT, alkaline phosphatase. We can test for if the liver inflammation has affected liver function with tests like bilirubin and INR and albumin. And then we can test for what might be the cause of liver disease by taking a history, doing a physical exam, and also there are these tests called serologies, which are different tests we can check in the blood to identify if it's autoimmune liver disease or a genetic disease or hepatitis B, hepatitis C. So the first is establishing, do I have a diagnosis of liver disease? And then the next question is, do I have scarring? Do I have cirrhosis? Since there are implications to having that progression of injury. So how do I know? So there's a toolkit that doctors have in terms of figuring out if someone has scarring. We can use a liver biopsy to say what is the cause of damage and how much damage, i.e. how much scarring or that fibrosis we talked about is there. We can use something called a FibroScan, which is a special kind of ultrasound that uses sound waves going back and forth through the liver. How fast they travel is related to resistance, and that resistance is related to scarring. We can use things like MRI or ultrasound elastography. These are all ways to get a sense of, is there scarring in the liver? There are other tests like ultrasound, but this really helps more with when we're seeing advanced changes of scarring like cirrhosis. And as I mentioned, lab tests, physical exam, and history can be really helpful to your care provider in getting a better sense of where do you stand on the spectrum of liver disease? And from that standpoint, what is your risk for problems in the future? Ultimately, though, we want to prevent liver disease to begin with. And then if someone does have liver disease, we want to prevent the scarring. So we're now going to switch our focus to prevention. So how do we prevent liver disease? Well, it depends on what kind of liver disease someone has. And non-alcoholic fatty liver disease is one of the most common causes of liver disease in this country. And the major risk factors are obesity and diabetes. So the goal is weight loss through healthy diet and exercise. And we know that if you lose 7 to 10% of your body weight, the fat can come out of the liver. So there's a way to actually reverse the problems that can develop from having fat in the liver. Improvement in diabetic control and optimization of diabetic control can really help optimize non-alcoholic fatty liver disease. Alcohol liver disease, obviously the main risk factor here is excessive alcohol intake. And we're going to talk a little bit about what is excessive alcohol intake. And if you have liver disease, you should not drink alcohol. And this is a really important conversation to be having with your physicians. And if you have cirrhosis, you should not be drinking alcohol. And if you have other liver diseases, it's really important to understand what might be safe for you. Hepatitis C virus is recommended to screen for in all adults over the age of 18 by the CDC. And as mentioned, we have excellent treatments that can actually cure hepatitis C, which is really a revolution in our field. And we are really excited that this can happen. Hepatitis B virus, we talk about screening. Patients are at high risk for hepatitis B, and often this is related to where someone is born across the world, as there are areas where hepatitis B infection is more common. And in those patients, some of those who have gone on to have difficulty either because of significant problems with irritation and inflammation of the liver or scarring, we can treat hepatitis B to control the disease so it doesn't cause damage. Autoimmune liver disease and genetic liver diseases, we have treatments, and so it's really important to be engaging with your physicians about what are my diagnoses, what are my treatments, are my treatments working to prevent inflammation and injury. The CDC definitions of weight and body mass index, I got this from the CDC website, and this is a way for you to check and see how am I doing with where I am on my weight spectrum. And you can type in CDC BMI calculator, and you'll see this calculator. And what body mass index is the ratio of your weight to height. And you can see in the spectrum of colors that normal body weight is a body mass index of 18.5 to 24.5, about 25. And you can see, am I overweight? Am I underweight? How might I think about nutrition and diet and exercise to move myself into a place where it's healthy for my body? And we're going to be having talks at this conference about healthy eating and cooking demonstrations. So it's really, these are things that we have the agency to change in ourselves. So it's just something to think about a little bit more. This is from the CDC as well, and these are recommendations for alcohol intake. And drinking in moderation per the CDC guidelines is 1 drink or less a day for women, and for men, 2 drinks or less a day. I like to talk to my patients about remembering that really daily drinking is not something that we should be doing, and we should really be thinking about what is the healthy amount of intake for ourselves. I have patients who say to me, but doc, I'm not drinking. I don't drink hard alcohol. I just drink beer or I just drink wine. And I remind them that all of those substances, beer, wine, hard alcohol, spirits, they all contain alcohol content. And so each type of beverage may have a different quantity of alcohol. So the actual amount of alcohol to get the same effect at the liver might be different. For example, at 1.5 ounces, like a shot of hard alcohol or a 5-ounce glass of wine, they have the same effect at the level of the liver. And so it's really important to be thinking about how are we using alcohol in our daily lives. So just kind of summarizing where we've been in these last several minutes is we want to prevent liver damage. But if we have any type of liver damage, we want to think about, am I the right person to be screening for liver cancer? So the first box is just talking about, let's treat the underlying causes of liver disease through medications, lifestyle modifications. And then the second box is talking about, okay, let's say you have cirrhosis of the liver. You should be screened for liver cancer. And hepatitis B, as mentioned, is a difference because you do not need to have cirrhosis in order to develop liver cancer. And I want to kind of talk about this a little bit, like why is cirrhosis a risk factor for liver cancer? And what happens in scarring and cirrhosis is, you can imagine if you cut your hand and you get a scar, that scar looks a little bit different than the rest of the skin around it. And that's what's happening at the level of the liver over time. You're getting more and more scar. The liver is trying to respond to the injury by healing it appropriately, but it heals it inappropriately, and you put down scar. That scar ultimately gets to a place of cirrhosis. And the cirrhosis, those liver cells are damaged and they can mutate. And what cancer is a cell that mutates, doesn't listen to the rules of stopping if you're not, stopping growing if you're actually abnormal. It just keeps growing, and that's what a cancer is. And so cirrhosis is a risk factor. Hepatitis B is a risk factor for cancer because hepatitis B is something called a DNA virus. And so our bodies are made of DNA. So hepatitis B can actually get into the DNA of a cell in the liver, as an example. And then if that cell mutated, it could grow into cancer. And that's why hepatitis B is a risk factor for liver cancer, even if you don't have cirrhosis. There are other things to be aware of, which really require a conversation with your doctor because there's a lot of nuance here. But people with fatty liver disease, some of them develop liver cancer without having advanced cirrhosis. And so talking to your doctor about, where do I sit in the spectrum, and is it right for me to be getting screened? And people who have had hepatitis C damage to cirrhosis, they've cured their hepatitis C, and their liver has gotten a little bit better. The question there is, do I still need to be screened? And oftentimes the answer is yes. If you've had cirrhosis, you should continue to be screened. So so I just want to make sure that this is very clear, because there are so many nuances in these things, and that's why having the knowledge for yourself, but then putting into the context of talking with your doctor is so helpful, because sometimes, it's the details around these decisions that are really important to engage your care provider in. So just as a general bullet point, in terms of who should be screened for liver cancer, those with hepatitis B, and there are different age cutoffs that we use and different specific points that are here in gray. Again, I don't want to lose everyone in the details, and your physicians should know these details, but if you are a man with hepatitis B over 40 years old, it's recommended that you start routine surveillance for liver cancer. If you're a woman with hepatitis B over 50 years old, it's recommended you start routine surveillance. If you have a family history of liver cancer and hepatitis B, it's recommended you screen. So there are groups within this. You might ask, well, what if I'm younger than 40 or 50 based on my gender? Well, we often in the liver world screen people, but we screen them once a year rather than what I'm explaining is the routine, which is every 6 months. Again, Lots of details, but the bottom line is, if you're in one of these categories, talk to your doctor about where you sit in terms of their recommendations. So what are the screening tests for liver cancer screening? Ultrasound and alpha-fetoprotein. The ultrasound here, there's a graphic of what an ultrasound looks like when the physicians are reading it. And then the alpha-fetoprotein is a blood test. The ultrasound is where we put a probe on the right side of the liver where I showed you the liver was. And there are shades of gray, white, and black. And the radiologists understand the nuances of these things, and they're looking for places that look abnormal. And so I put some arrows on the ultrasound here where you can see that there is less gray, more black in an area. And that is like, oh, there's something that the ultrasound is abnormal. What does this mean? And then we would go to the next step. We'll talk about the fact that the alpha-fetoprotein, which is another one of the tests we use, the blood test, is not perfect either. Neither of these are, and that's why we recommend doing them every 6 months. We can see trends as examples. But the alpha-fetoprotein, people with liver cancer can have a normal level of this tumor marker. Up to a third of people with liver cancer can have a normal level. So again, in and of itself, either of these tests alone is not enough to make a diagnosis of liver cancer. These are just ways for us to get a sense of, is there a potential problem that we should move forward with? I just wanted to remind us that not all spots mean the same thing. And I tell this to my patients because if you are a 50-year-old woman with hepatitis B and you're going to be getting ultrasounds every 6 months for the rest of your life, you might be getting a lot of ultrasounds. And so sometimes there'll be a spot on the liver and we'll be like, what does this actually mean? And I just wanted to remind us that spots, doctors use words like spots, lesion, nodule, mass, but not all of these represent liver cancer. There can be non-cancerous masses, or there could be things that we see on ultrasound that actually don't sort of pan out when we look more sensitively with other types of imaging that I'll outline. The types of liver cancer that we see in the liver, as mentioned, are liver cancers from the liver cells. That's called hepatocellular carcinoma. There can be cancer from the bile ducts, which is called cholangiocarcinoma. And there can be cancer that spreads from outside the liver, from other places with cancer, like the colon or the breast, and it goes to the liver, and that's called a metastasis. Liver cancer diagnosis by CT scan or MRI is ultimately how we say, hey, it was one of those spots, a concerning spot. And I like to call this the light bulb effect. And what it is with a CT scan or MRI, we use contrast. And so we can actually see how the blood is flowing through these spots. And what liver cancer does is it lights up really bright when the blood flows through at a certain time. And then when the blood kind of goes away at a certain time, it gets dark. So you can see with these arrows, you've got a light bulb, and then the light bulb goes dark. And so if we see this in the right context of someone with hepatitis B or someone with cirrhosis, this is what Dr. Tidy was talking about, where we don't always need a liver biopsy because this is very, very suggestive of a liver cancer. Sometimes people have spots and they don't follow these rules of the light bulb effect, and then we have to talk about, should we biopsy? So ultimately, the reminder here today is that there's a spectrum of liver disease, and some people will go on to get scarring, ultimately cirrhosis, which is scarring of the whole liver, and then cancer. And so really what we want to do is prevent there from being a problem to begin with. So by eating a healthy diet, which we're going to talk about during this seminar, maintaining your ideal body weight and using that calculator to understand where in the spectrum you may sit, talking to your doctor about alcohol use, what's healthy, what might not be healthy, exercising, not only because it's good for the liver, but it's good for your heart, it's good for your mood and sleep, treating the underlying conditions we have medications for, and then talking to your doctor if you're at high risk for liver cancer, and then doing the ultrasound and alpha-fetoprotein every 6 months and following up on the results to understand if there are concerns.